Hello my friends. Back in August of 2021, during our strategic planning meeting, I agreed to do a screencast on what we teach on documentation in second semester in our patient management course, PT707. So this is belated. I was hoping to get it done sooner, but here it is. So these are some of the concepts that I'll review with you today, just give you an idea of what we teach in second semester. So we'll talk about the patient management model, examination versus evaluation, and helping them understand the difference between those. Also the difference between the systems review and the review of systems. Using the ICF model as a framework for viewing the examination and actually the interpretation of data, and then writing SMART goals. So we start the semester by introducing the students to our source document, the APTA Board of Directors Documentation Patient-Client Management. And this document describes the patient management model that's shown here. So we go through each aspect of the patient management model. I also want to point out that it does show the decision point, that critical decision point at the top there at evaluation, of whether we treat and refer, or refer. It also shows how diagnosis and prognosis are part of the evaluation process. So that's just kind of the basics of the patient management model that we introduce right at the beginning of the semester. Also in that first week we talk a lot about the ICF model and teach the students how to use that to take them from impairment to activity limitation to participation restriction, all the while taking into account environmental and personal factors. We give them lots of opportunities to practice using this model, and I do promote using this model as a framework for their clinical reasoning. So it would be great if that concept could be reinforced in subsequent semesters and teach them how to continue using that ICF model and refine their ability to use that model efficiently, especially where they're going to be having to use it in their capstones. So now jumping back to that patient management model, the first step in it is the examination. And so we teach that the examination consists of the history, which involves pre-interview tasks like chart review, looking at intake forms and possibly communicating with the referring provider, and then the interview. And we teach them that documenting this, this is subjective information and should go in the subjective portion of the note. Then the objective portion of the note would include any physical assessments, which would include the systems review and tests and measures. And as we teach this, we try to stay consistent with the terminology used in that APTA Board of Directors document that I referenced earlier. It just keeps it simple and also follows the professional standard of care from the APTA. So now let me back up for a second and just talk about that subjective information again. Part of this is the review of systems, and this is something that tends to be a sticky point. What's the difference between review of systems and systems review? This is terminology that I don't necessarily agree with, but it's what we're stuck with, and it's throughout that APTA document. So I try to teach it consistent with that. So the review of systems is this subjective information that we gain from either the intake forms or from questions that we ask during the interview. The way that the APTA describes this is the general review of systems, which would be what you typically see in an outpatient intake form, all these different questions that ask about systemic issues. And then the verbal review of systems is a specific set of questions that we'll ask to rule out problems in specific systems. So these questions would be things like, have you had generalized joint or muscle pain not related to your current complaint, to rule out musculoskeletal problems? Have you noticed any generalized weakness or decreased coordination unrelated to your current complaint, to rule out neuromuscular problems, and so forth. So it's been shown that those questions, as a follow-up to the questions on the written questions on the intake forms, is a very effective way to get to the bottom of any red flag issues. So that is the review of systems, and now we'll talk about the difference between that and the systems review. So this is how we teach the difference. The review of systems is verbal, and the systems review is physical. So I already mentioned the makeup of the review of systems. It can be the general review of systems that's part of the intake forms, and the verbal review of systems that is part of the interview. And then we move into the physical part of the examination process, and that's where we do our systems review, which is basically the physical screen of all of those major systems. And that systems review consists of observation, including an observation of cognition and communication, taking vital signs, doing a movement screen, and doing a neuromuscular screen that would include dermatomes, myotomes, and deep tendon reflexes. And we try to reiterate that these are screens, like for instance that the myotomal screening is not manual muscle testing, that those are two different things, and that the purpose is very different between them. So we try to make that distinction for them, and I don't know that it always sticks, so that's another thing that could be reinforced in subsequent semesters. Okay, so that's the basics of what we teach on what the examination consists of, and then we make the distinction between that and evaluation, which is the thought process that's going on all throughout every visit. But in the initial evaluation, we talk about how they gather the data in the examination, and then in the evaluation they interpret that data and synthesize it and use that synthesis to come up with a diagnosis and a prognosis. And I'll just mention too, this is something I've seen in capstones, that the prognosis, according to the APTA documentation, it should consist of both a functional level that we're hoping they attain by discharge, and the time frame by which they'll attain it. So their prognosis statement should have both of those in it. And then we also again reiterate that this evaluative process should be going on throughout the episode of care. One other thing I want to mention about evaluation is that we teach them to use the ICF framework to guide their thought process as they evaluate. So they take that data that they gathered in the examination, and then they use that to identify impairments from their specific examination findings, and then interpret that to include how those impairments are affecting activities and participation in life roles, and then assessing how different factors present in the patient's case might contribute to changes in their status. So if there are cognitive issues or comorbidities that might make that prognosis a little further out than you'd typically think with the natural history of whatever condition they have, social support and motivational factors as well. So we try to reinforce that ICF model can help them make a quality evaluation and interpretation of the data that they collect during the examination. We also teach that another crucial aspect of the evaluation is the formulation of SMART goals. So we teach them the SMART categories and have them practice it. They have an assignment where they have to write SMART goals, and we give them very specific feedback. So hopefully by the time they get to you in future semesters, they can actually write a decent goal. And just so that you're aware, there are a few other topics that we cover. One is SOAP note structure, and teach them each portion of the SOAP note and what goes in each portion. They always have a struggle with the assessment section of the SOAP note, and I suspect that will continue to be an issue in other semesters. So reinforcing the use of the SOAP structure would be good. We also give them the opportunity to practice documenting in WebPT, and basically they just take an existing note and transcribe it into WebPT to get that practice of kind of seeing where things go in an EMR. And then finally we introduce them to the SBAR technique for interprofessional communication, and they actually practice that. They have an assignment where they make a video of them communicating with another interprofessional team member using SBAR. Okay, I tried to keep it short and sweet, but if you saw anything that you felt needed to be added or taken away or changed, I'm open to suggestions. I want to make sure that we're teaching things in a way that it helps to reinforce things that you teach later on. So please let me know if there's something that you feel would be important to add here in the second semester in our introduction to documentation. Thanks for listening.